and welcome back. I'm Mabel Jong. You're watching WHCC TV, coming to you live from Washington, D.C. This is your one-stop shop for all the great content coming out of the World Healthcare Congress. Now, HHS very recently launched an ambitious double-pronged strategy to shift primary care from fee-for-service payments to a global fee model. Where does this leave us? We're going to talk with Dr. Norman Chenven, founder and CEO of Austin Regional Clinic, and he joins us in the studio now. Dr. Chenven, thank you so much for joining us.
How are you?
Very well.
Good.
And you've been keeping your eye very closely on the developments in the healthcare sector. Is this most recent move toward value-based care speeding up or slowing down?
Okay, so the ACO movement, which was launched in the early teens, 2012, 2013, has grown and done well, but there have been some casualties along the way. I think that the model that has been developed so far has gone about as far as it can go in terms of volume and growth. And I think it's very exciting that HHS is adding some new impetus to make it grow. And what they're focusing on is primary care. And what we have found with ACOs is that over time, the ACOs that are built around strong primary care entities do better. You need a very strong effort to manage individual patients and bind them to their primary care doctors. So this initiative that has been announced just last week, I think will bring more primary care doctors in. It will encourage more ACOs to focus on their primary care providers.
Okay. What was this most recent development you say will ignite some more activity, correct? Yeah. What was happening before we saw this latest move?
So we've had the ACO model, which attributes patients to physicians, requires a lot of infrastructure to be built in order to monitor the patients, to identify the patients who need the most help, and then also bring social services and other factors to bear to make sure that those patients get good care. That has happened mostly in larger institutions like my group, like some of the integrated systems, hospital and physician groups that work together. I believe that this new initiative is meant to try and intrigue and capture a lot of the smaller practices around every community that have not yet engaged in doing managing their care and working with ACOs.
Okay. And what about Medicare patients?
Well,
how will they be impacted?
Yeah, so this is largely focused on Medicare. Once an ACO evolves, it can then develop a patient-centered medical home because it requires the same infrastructure, strong information systems, analytics, nurse navigators, people reaching out to make sure people get their preventive care. But this initiative that has been announced is purely Medicare, and the attempt is to move traditional Medicare patients into systems like this. We haven't talked yet about Medicare Advantage. That's been evolving for a while now, and it's been very successful. About 30% of the patients in Medicare are in Medicare Advantage plans today, but there's still 70% that are in traditional Medicare and not getting quite the same level of management. This is an attempt to push forward and reward physicians and hospital systems for going the extra step and making sure people stay well.
How confident are you that physicians have bought in to this?
So it varies by geography and it varies by employment group. It varies by the systems. There are some hospital systems that have not bought into this and have not encouraged their physicians to get involved. There are many, many smaller practices that are essentially oblivious of this movement. And that Council of Accountable Physician Practices that I'm the vice chair of has worked very hard to educate physicians as well as the general public about the advantages of an ACO model or a patient-centered medical home model.
Well, if we don't see more buy-in, will we see that as a hurdle for more growth?
Well, absolutely, and that's why the models need to keep evolving. We have seen a lot of buy-in. For over the past decade, there's been enormous progress made, but it's starting to stall, and I think that's why we're seeing these new initiatives come out of CMS.
What could we see after this, even to ignite even more growth if we start to see
Well,
a slowdown?
so whether we like it or not, the payment model ultimately is what will drive what happens in healthcare. And that's a difficult thing to evolve. We're coming from a payment model of pure fee-for-service, where physicians and providers and hospitals were paid for the things they did rather than for providing medical care and keeping people well. So the ironic situation in fee-for-service is physicians and hospitals can't make any money if nobody's sick. Well, that doesn't make any sense because we should be driving toward keeping people well. And these models reward us for keeping people well. If you provide the preventive care, if you manage the chronic illness, you keep people from needing to go to the hospital, from needing home health, from all the rest of that. And you turn on the creative juices of the doctors, in particular primary care doctors, how to engage their patients, to take care of themselves, to avoid all the expensive care downstream that is required.
Dr. Chenven, what is the message you want to leave attendees of this conference with? What is the one thing that you think is very important to remember when they leave on Wednesday?
There are a lot of messages.
Sure.
Healthcare is incredibly complicated.
Yeah, very complex.
I would say from the perspective of the Council of Accountable Physician Practices, we believe strongly that the payment model needs to continue to evolve to where physicians and physician-led organizations are rewarded for keeping people well. And when you keep people well, you actually reduce the overall cost of care. Mm-hmm. And that is a difficult concept for Americans to understand. It is a model that has just not been in the forefront until the beginning of the ACO movement. The ACO movement is a way of bringing people in one step at a time. It's sort of baby steps into this kind of model where payment is, frankly, wholly dependent on how well you take care of the patients, on the outcomes, rather than the procedures and the diagnoses.
Mm-hmm. And may I ask, what keeps you coming to the World Healthcare Congress?
Well, there's just a lot of smart people here. I learn something every time I come, and I love this business. It's okay to be doing good work for good people. So.
Dr. Chenven, we're going to leave it there. Thank you so much for your time.
Thank you.
And I'm Mabel Jong. Thank you for watching. Stay tuned. Much more to come.